Hey, Coach Jeff here. So we got this week's movement enhancement technique. This is actually part 2 of the hip. Previously we did the glute medius, the glute minimus, glute max, and then the tensor fasciae lata, and mostly just release work. And the reason why I went with that is those are the not necessarily the TFL, but the glute minimus, maximus, and medius attached to the greater trochanter, and they tend to have trigger points that refer pain into the, they can refer into the glute itself, into the low back, into the sacrum, down the leg, down the side of the leg, down the back of the leg. So it kind of feels like it's mimics piriformis syndrome or sciatica. So sometimes we could have some glute medius or minimus trigger points, and then next thing you know, it feels like it's running down the leg, and then we start thinking we have sciatica pain or piriformis syndrome from the sciatic nerve. Which, if you're having pain going down legs, you should get it checked out. But that said, a lot of times we have just some trigger points in the glute medius and minimus. Okay, onward. So this week we're going to work on more of the muscles of the pelvis, that attach either to the femur and the pelvis, or the rib cage and the pelvis. Actually, we're not going to do that one this week. Let's just stick to the lower half of the body. So we got hamstrings, quads, adductors, and external rotators of the hip, which they're the deep 6. They're underneath the glute max. They're down in here. I'll show you how to work on those with the foam roller or a ball, with caution, because the piriformis, or not the piriformis, but the sciatic nerve runs through that area, so we need to be careful and not irritate it. That being said, I'll show you how to work on that. And then some, like I said, corrective movement. So starting with the hamstrings. Hamstrings attached to the lower leg, and then attached to basically the pelvis or the ischial tuberosity. Okay. I personally like to work these in on an elevated position. As you can see here, this is a 2-foot high, 24-inch plyo box, and then I have a fairly firm black foam roller. And what I like to do here is I'll place the roller diagonally from corner to corner on the box. At home, I just use a tall stool, like a bar stool or whatever. And then I'll straddle the roller, the box, and then I work on the hamstrings. I find I get the best result this way, rather than trying to roll the hamstrings on the floor while I'm on the floor. So I'll work the hamstrings. If I find a tight spot, I might go ahead and just stay on it, and then do some active range of motion. So knee extension and knee flexion while I'm just holding the spot. Now, that is a internal glide of the tissue, so that's a good way to get some mobility. All right, and then don't forget that your body's 3-dimensional, so I'll work more on the lateral side, right in the middle, and then more on the. So I'm going to use my leg, and then I'm working more the inner part of the back of the leg, and even adductor here. I'm probably getting adductor magnus. I know I'm getting adductor magnus here, which is part of this series. So, and for me, that tends to be a really, really tight spot that I need to work on. And like right now, I'm on a spot that's actually referring pain into my hip and maybe a little bit into my IT band. So I'm just going to hang out there and breathe and look for it to reduce its intensity. And once that happens, then I'll move on. I can also do active range of motion here. Yeah, I haven't done this in a while and definitely need it. Anyway, so that's the hamstrings and partially the adductor group. Okay. So next, piece of paper here. We want to work on quads. And obviously we've got the foam roller, we can work on the quads. I'll just demo real quick. Let me get this out of the way. And you're going to want to maintain good spinal posture. And I recommend working one side at a time. And the reason for that is I want to, again, work the middle part of the quad, that lateral part, and the medial part, or the inner thigh. So here, I'm just working on the top. Let me get you a little bit better view here. Okay, and so again, I'm going to maintain my posture. I'm rolling on that quad. Now, this spot right here is really tender for me, so I'm going to go ahead and hold and then back down. So that can be pretty intense. That was pretty intense. Make sure you're breathing, make sure you maintain posture, and you need to search all along the front of that thigh to make sure you're getting everything. And then I want to actually get a little bit lower so you can see this better. And I think this view is going to be the best. This is how I would work on the adductor or inner thigh. So you can see I'm going to keep my back neutral as best as I can, and then I'm working that inner all the way to the medial knee. That can be really tender there. You even have to bring your leg up a little bit to get different parts. And I'll go as close as I can to the pubis or the pelvic bone. All right. So that's the adductor group with the foam roller on the ground, and like I showed on the box, you can get the adductor group more, but more on the posterior side or the back side of the body. And then finally, the lateral quad. This one, pretty brutal. I'll put this leg down. I'll be in kind of like a modified side plank position, and then I'll just work kind of an anterior lateral position, turn a little bit until I'm totally sideways. And I'm pretty tender. It's hard to deal with. But this leg here helps with controlling how much pressure this foot here. Okay. And really try to maintain good posture. Get on a tight spot, breathe it out. Okay, so that was the quad, including the adductors, and then the lateral quad and the IT band. I will say, and I will add this in because we did this last week, but this is another great way to get the tensor fascia lata as well. So I'm just going to turn slightly and work on that muscle. It's right here, kind of the anterior lateral hip. Yeah, pretty tender. Okay, and that's the TFL. Obviously you can do that with the ball. And then next we want to work is the external rotators of the hip, or the deep six. Now this is probably the least invasive of how I would approach this, but what I'll do is actually externally rotate the femur. So I'm putting that leg up, and then I'm just gonna roll the glutes. If you roll over a spot and it sends numbness or tingling down the leg, or like a jolt of electricity, then don't go there again. Stay away from that. Okay, so I'm just working all along that glute max. Go to the sit bone. So when I get more upright, I'm at the sit bone. Right as I come off the sit bone, I'm really going to start hitting those external rotators. Right as I come off that sit bone. You got to be careful. Just pay attention. Don't aggravate that sciatic nerve. Okay, you can do some releases or myofascial work with the stick, and I'll just demonstrate. You can roll the stick, which sometimes I favor over rolling itself. I can control the pressure. I can get more detailed work in. I can work around the bony landmarks a little bit better than I can with the foam roller. I can work the hamstrings here. So I'm just sitting down nice and tall, working all parts of hamstring, and I can work inner thigh. So just to show you what that looks like, inner thigh here, adductor group. Okay, quad, inner thigh, top of the thigh, lateral thigh. So lateral thigh, IT band, great tool. It's harder to do glutes with this. I prefer using the roller for the glutes. And then obviously you can do ball work. A third option, if you have one, you can work, which I would be careful on the glutes with this one. It gets pretty aggressive. I would be afraid to irritate the piriformis. Not piriformis, I keep saying piriformis, but I mean the sciatic nerve. But you can use your Theragun. And you can do active range of motion. You can straighten your leg, bend your leg, hamstrings. I'll work the glute here, do some glute work. Come around into the hamstrings, belly, lateral hip, TFL, hip flexors. Okay. So I don't know if you heard that with all that racket, but you can get all those muscles we were just talking about with a Theragun. Okay. All right. I'm just gonna grab a ball real quick, and I want to show you the work with the ball. I prefer a larger ball for this work, to be honest. So this is like a 4 or 5 inch in diameter ball. So again, you're gonna do quads, get on top. This is way more aggressive. Find the spot, work it. You wanna do lateral. You can do inner like we just talked about with the roller. Get in, work that inner thigh. Okay. You can work the glute as well. Again, remember, this is more aggressive work, so progress carefully. And last but not least, you can do some of that work up here on the box. So, which I prefer doing the hamstring work. So I'll sit, get the hamstring right on top. I'm sitting on the box, but my legs resting. So there's a side view. And that creates a lot of pressure. And then I can just take my leg through range of motion, get nice and tall, move it to another spot. That's how I like to do that work, okay? So tons of options to do the myofascial work, okay? Get those muscles to lengthen, get them to move and glide better. All right, so let's go into the movement part, okay? So for myofascial, we did hamstrings, quads. Remember, we gotta go 360 degrees around the leg. Careful here in the glute max for the piriformis, or sciatic nerve, not the piriformis. And then you are actually working on the piriformis when you do that work. And then now, since we've released some of this muscle tension, restored length, hopefully improved gliding of the tissue with this work, we should do some movement. So one is a quadruped rock back. And I'm gonna have my toes under, I'm gonna set the core, I'm gonna inhale, sit back, and go as far as I can without changing or tucking my tailbone under. Okay, so that's kind of working on that hip joint, mobilizing the joint and the posterior, especially the posterior capsule. So good mobility work there. Then we can do a unilateral version with this one. I'll do this on a client on the table. So I want to get nice and tall. And when I go from a quad rock back to the unilateral, I'm going to bring my leg across, shift my hips slightly. I want the femur to stay mostly vertical, and then I can do little circles above it, rock back and forth. The tendency will be to go into pigeon, which is fine, but do that later at the end or something. I want you to really focus on working on centering the hip and mobilizing the posterior joint capsule. Okay, so it's kind of envision it as like we're compressing the joint capsule so it releases and relaxes, which is pretty effective when I do it on the table. And then just some movement. We want to do what we call a stride with external rotation and a stride with rotation. So I'll demonstrate both of those. So in this case, I got a 24-inch box. I want to bring my leg up. You should be able to get your leg up and keep your spine straight. And so this is called stride with rotation. I'm going to extend the hip. Both feet are straight, they're hip width apart. I'm going to get nice and tall, extend the hip, and then rotate. Come out, extend the hip, and then rotate. I'll show you from this view. Extend the hip, then rotate. It's been a while since I've done these. Okay, so that's stride with rotation. Stride with hip external rotation looks like this. I gotta get you back up here high. Probably cut off half of my head, but that's all right. I think you guys can see what I'm doing. Yep. So I want to get into this figure 4 position. This box is actually a little low for me, but you can see I'm maintaining good posture. I'm in this standing pigeon, and then I'm just going to hold it. Okay. Now, if you're a person that has reduced range of motion, and for example, your knee doesn't want to get down on the table or on the box like I do, you're going to have to block that leg up so you don't put pressure on the knee. So for example, I'll just stick that foam roller there, work on that. We want to try to get this knee aligned with the hip and the tibia at a 90-degree position. And then the hip should not roll out. Hip should be forward in that stride position. Then my foot on the ground, the toes are pointing straight ahead like I'm pushing off in my run. So this would be the leg up. There's my stride position. Okay, so these two are right out of the FMS. All right, and when you're pulsing, this one you're just gonna hold. All right. Okay, you guys, remember this is gonna help with hip centering, which will improve mobility, decrease pain. You're also gonna address some trigger point stuff with this. Obviously, I didn't show you the exact locations of trigger points. You'll probably find them on your own, honestly. And then help improve movement, okay? All right, you guys, have a great week.